Hello, and welcome to the presentation on Healthwatch Salford's report on remote appointments, which was a project we undertook early this year to look at remote healthcare appointments for patients during the COVID-19 pandemic. My name's Mark Lupton, and I'm part of the engagement team. So a little bit about the project. At Healthwatch Salford, we wanted to explore potential inequalities in the shift from face-to-face appointments through to video consultations, telephone calls, etc. At the same time, Healthwatch England were undertaking a national project looking at digital exclusion, and we felt it quite appropriate to align our project aims to theirs. So with this in mind, we wanted to have our main focus of speaking to three cohorts of patients: those people over the age of 65, those people who are living with a disability, and those people whose first language wasn't English. In addition, we actually got some insightful evidence from autistic people who gave us a little bit of background information as to how the pandemic and remote appointments has affected them. So how do we do it? Basically, we wanted to create a report comprising of a suite of real-life patient stories following telephone interviews with these patients. Because of it being digital exclusion, we were very heavily reliant upon patients coming forwards and sharing their stories with us, but we found it really, really difficult to reach patients. So we produced over 700 flyers and posted them to Salford GP surgeries, in turn asking them to send them out to some of their patients who they felt would fit into our cohorts appropriately. We also produced some pop-up banners which we disseminated across the vaccination centres, encouraging patients to come forwards and have a chat. But all in all, we were heavily reliant upon community organisations in spreading the message and encouraging people to come forwards. By the end of the project, we'd spoken to 23 people, 5 people from each of the cohorts we'd aimed to go for, plus 2 autistic people who represented others in their community. In addition, we also spoke to 6 staff who worked across health and care. So what did we find out? Well, we found that none of the patients we spoke to had actually experienced a video consultation. Everybody was either face-to-face or telephone. We also found that primary care services have actually done a lot over the last 12 months to implement video consultations with new equipment, training of staff, etc. Some secondary care clinics had actually used video consultations, but there were some teething problems and most of the patients opted to go back to phone or face-to-face. We did find in one instance that remote appointments had helped to reduce somewhat the referral waiting lists for one clinic. So what we did was we grouped our findings into themes. Under the theme of privacy, we found that patients found it difficult talking about personal matters over the phone. This could be due to their environment, if they were having a phone conversation and it wasn't a private space, or they were calling from work. Overwhelmingly, under the theme of choice, all the patients we spoke to were not actually given the option of a face-to-face appointment, many of whom said that would have made the appointment and consultation a lot better. Under the theme of confidence, we found that patients didn't have confidence that they actually understood what was being said, with many of them putting the phone down at the end of the call and forgetting what the doctor had said to them. And communication, we found that patients found it difficult in understanding when not face-to-face. For example, those people who either lip read or have issues with interpreters. And awareness, patients told us that they just didn't know where to go for support. So from these 5 themes, we're able to come up with some recommendations. Our first recommendation under the theme of privacy is that clinicians should ask the patient if they're happy to talk with confidence in their home environment before proceeding with the consultation, offering a face-to-face appointment in the surgery to those who identify privacy as an issue. The response from Salford Clinical Commissioning Group was that they will raise awareness of this issue with Salford GP practices. The CCG also intends to share this with senior clinicians, including GPs, to explore how this can be promoted as best practice. Under the theme of choice, we made a recommendation that staff who are the first point of contact for patients should be trained to identify those who may struggle with remote appointment, for example, hard of hearing or they need to use interpreter, and they should feel empowered to be able to recommend a face-to-face appointment with the clinician. The response from Salford Clinical Commissioning Group was that they are in the process of developing an interpretation and translation training programme, which will address a number of areas such as dialect awareness, non-verbal communication, and British Sign Language. Under the theme for confidence, we said that all staff should check back with the patient at the end of the call or video call to ensure that the patient has actually understood what has been communicated to them, opening the door for patients to ask further questions if they are unsure. The response from Salford Clinical Commissioning Group was that they advised us that this should be carried out as clinical best practice as part of the consultation which is carried out by the clinician with the patient. This would be expected standards of professional bodies such as the General Medical Council and the Royal College of Nursing. Under the theme for communication, we made 2 recommendations. We said that access for deaf British Sign Language users needs to be improved with the prompt answering of text services where they are provided. We also said that patients who use interpretation services should be provided with information on where to raise these comments about services. The response from Salford Clinical Commissioning Group confirmed that all Salford practices should be familiar with the booking of specific language or British Sign Language interpreter. Where patients have concerns regarding the quality of an interpreter, this should be raised with the GP practice, which can then be escalated to Salford CCG, who also have the ability to raise any concerns directly with the provider in question. The CCG says that it understands that this raises a question as to how individuals with British Sign Language as a first language can actually raise concerns in the first place. As such, the CCG are exploring this through various forums at a local and national level, including social media platforms, to raise awareness amongst British Sign Language patients of how they can raise any concerns they may have. Under the theme of awareness, we made 2 recommendations. We said that commissioners and providers need to raise public awareness about the different ways in which people can engage with their healthcare practitioner and where they can go to learn or improve their digital skills. We also heard that changes to services, no matter how quick, need careful consideration as to how these will be communicated to the public, taking into account the diverse needs of the Salford community. Use of language, plain English, and ensuring the messages are disseminated as widely as possible is essential to ensure any change is communicated and understood. The response we got from Salford Clinical Commissioning Group was that they said there are many various mechanisms and ways of which commissioners are able to raise awareness of any changes to the delivery of healthcare provision. The CCG has an extensive social media presence in Salford, as well as utilising the Life in Salford magazine to reach as many Salford patients as possible. When services are being recommissioned or procured, the CCG involves various patient groups and forums to update on changes in models of care. An example of this includes the CCG's Citizen Panel, which connects the CCG with over 5,000 patients across Salford. The Citizens Panel has previously held face-to-face meetings in the Salford community, and once restrictions are lifted, the CCG will look to review what engagement mechanisms can be implemented. In addition, we also shared our report findings with the Northern Care Alliance, who are responsible for overseeing Salford Royal Hospital. We heard from them that they said that they welcome the report and they are already actioning issues within the report around the challenges to communicate and engage with people in 2021 through their Meeting Elective Care Needs Across the System programme. They were looking to include lessons within this report regarding primary care and patient experience in a launch workshop being held in 2021. So what happens next? Well, our report has been published. It's on the website and shared with partners across Salford, and also shared with Healthwatch England to add into their larger piece of work looking around digital exclusion. We're going to continue to gather feedback and build on this intelligence of patients' experience with remote appointments. And most importantly, we're going to revisit our recommendations later in the year to measure what improvements have actually been made. Thank you ever so much for listening to the presentation. If you would like any further information, you can contact me on any of these details below here. Thank you.